Thank you for taking part in our test of an online recorded education session about fall prevention and what you can do as an older adult to reduce your risk of falling. My name is Christine Bidmead and I'm a Programme Manager at the Regional Geriatric Programme, RGP, of Eastern Ontario for the Champlain Regional Fall Prevention Strategy. You have been specifically registered to take part in this pilot and we're very grateful to you for doing this. You should have received 3 documents in the email with the link to this session, and these documents are referenced in this presentation. They are the Staying Independent Checklist, the You Can Prevent Falls pamphlet, and the My Falls Action Plan. If you have any comments or questions during the presentation, please email us at rgpeo@toh.ca, and we will get back to you as soon as we can. We'll need to make sure that we have your name and email contact. Thank you once again, and let's start. Hello, my name is Christine Bidmead, and this is the first of 2 education sessions on why and how you can prevent falls. During this fall prevention session, I'm going to talk to you about why falls are important for you and for others. That falls are not inevitable as you age, that they will be a sign that there is something wrong with your health, and that can be dealt with. We will learn about the risk factors of falls and, most importantly, what you can do to reduce your risk. A fall is not a normal part of aging. What is a fall? The World Health Organization defines a fall as an event that results in a person coming to rest inadvertently on the ground or the floor or other lower level with or without an injury. We also know that a near fall is when you stumble or trip or almost land on the ground but manage to catch yourself, like putting a hand up to stop yourself from falling. And we all know those times, and we need to recognize them as a warning that next time we might not save ourselves. It's important to tell somebody about that, your healthcare provider, your pharmacist, your caregiver, or a family member. Remember, your doctors and your healthcare team don't know what they don't know, and they rely on you to tell them so that they can help you prevent a future fall. So let's start. Injuries from a fall are 5 times higher when you're 65 plus. Do you think that's really true? It's actually false. You're 9 times higher, 9 times more likely to have an injury from a fall when you're over 65. And here are some other facts about falls. Almost 50% of fallers suffer a minor injury, and between 5 and 25% have a serious injury. 95% of hip fractures are due to falls, and the sad fact is that about 20% of people who have a hip fracture die within a year of the fracture. The average Canadian senior spends 10 days longer in hospital for fall-related admissions than for any other cause. 40% of all nursing home admissions are due to falls. And men are more likely to have a fatal fall, probably because they're more active and probably because they take more risks, such as I have known somebody climb onto a roof, etc., and maybe don't take notice of warning signs. In 2010, Ontarians spent over $2 billion on the direct cost of fall-related injuries. And that is 10 years ago. And that is only the direct costs and doesn't take into account the other costs, such as family involvement, having to be more caring for parents that were previously independent. But the good news is that many falls can be prevented. So why do falls matter? A fall can shake you, even if you don't have an injury. It can impact your quality of life due to injury, disability, and your loss of independence. It's easy to fall into the vicious cycle known as the post-fall syndrome. This cycle shows how a person can lose confidence after a fall, which means they stop restricting their activity. Maybe they don't walk the dog anymore, but get a local team to do that for them. This can mean losing their own stamina, strength, mobility, and independence, and not getting out into the fresh air and sunshine. This can potentially lead to another fall, and so the cycle continues. Statistics only tell part of the story. This cycle also has an impact on the individual caregivers and family members as the senior becomes less independent and less mobile. But we know from research that most falls can be prevented and that this cycle can be reversed. So why do people fall? The risk factors for falls are numerous, complicated, and interrelated, and we can't get caught up in dealing with just one risk factor. We need to look at the big picture. Medical and health conditions, vision and hearing symptoms, dizziness, weakness, bowel and bladder incontinence, pain, these are all medical and health conditions that can affect falls. The interaction of medications and medications that you may be taking that you no longer need, medications that mix with some things that you've bought from the health food store. Inactivity. This is a big one. The less you move, the less you want to move, and the less you're able to move. Poor nutrition. The body needs fuel and support. Hazards and safety issues around the home and outside, and certain behaviors and choices that we make. We'll talk about some of these today and some in the next session. So, the first thing we're going to talk about is what you can do, and the first thing you can do is to complete the Staying Independent checklist. This is a checklist that you fill out just for yourself. You fill it out with a family member or a caregiver. If you score 4 or more on this checklist, you should make an appointment with your healthcare provider, your family doctor, to review and find some solutions. Talking about falls and how to prevent them is the first step in prevention and dealing with what may be causing the issues. Sometimes it's very simple. I'm an old physio who used to work in home care in the UK as part of a rehab team with a nurse and an OT and rehab assistants. We had one lady who lived alone with a carer, or PSW, coming twice a day to help her get up in the morning and get her back to bed in the evening. She was referred to us for falls, as she was often found on the floor beside her chair. We assessed her strength, her mobility, her walker, etc., but it was the OT who asked her what the time was. The patient leaned forward and sideways to look at a clock on the wall behind her. She became dizzy and literally tipped out of her chair. We moved the clock. The doctor reviewed her blood pressure medications. We showed her how to get back into the chair, as well as some strengthening exercises, and she didn't fall again while I was on that team. Sometimes it really is something very simple, like moving a clock. A regular medical exam is really important. And when you go to talk to your healthcare provider, discuss how often you should see them. See them if you have symptoms or you're not sure what the issue is. For example, dizziness, weakness. You want to be able to detect health problems early and report any falls or near fall to your healthcare provider, and if appropriate, including staff if you live in a retirement home. Discussing your fall can help identify why you might be falling and what can be done to help. It's all about prevention. So this is the Staying Independent checklist, and it's recommended as an excellent way to screen yourself for your risk of falls and to have the conversation with your family, your carers, and your primary care provider like your GP. I'm going to run through the questions to explain why they're important. I have fallen in the last 6 months. People who've fallen once are much more likely to fall again. I use or have been advised to use a cane or walker to get around safely. Sometimes I feel unsteady when I'm walking. I steady myself by holding onto furniture when walking at home. So these questions are about being unsteady while you're walking, and that's a sign of poor balance. It may be something that can be improved with strength and balance exercises, or it may be a medication that you're taking that can be reviewed. I'm worried about falling. As we talked about earlier, worrying about falling can make you more likely to do so, just like the vicious cycle we showed. I need to push with my hands to stand up from a chair, or I have some trouble stepping up onto a curb. Both these last two show a sign of weak leg and hip muscles, and that is often a major reason for falling. I often have to rush to the toilet. Rushing to the bathroom, especially at night, increases your chances of falling, And some incontinence issues can definitely be a sign of something wrong with your health. I have lost some feeling in my feet. This obviously can cause you to trip or stumble or fall, and can also be a sign that there's something wrong with your health. I take medication that sometimes makes me feel lightheaded or more tired than usual. Or I take medicine to help me sleep or improve my mood. Medications can often have a side effect of making you dizzy, and they should be reviewed regularly. I often feel sad or depressed. Depression or feeling unwell or low are often linked with falls. Regular physical activity is an extremely important thing you can do, and the most important thing you can do to reduce your risk of falling. Physical activity means move more, sit less. You need strong muscles and bones to keep fit, to keep strong, flexible, and stable. If you don't use it, you lose it is a very apt saying. You need to be active to continue with your daily activities and do the things you enjoy, like playing with your grandchildren, going for a walk, bowling, dancing, whatever it is that turns your crank. And it's never too late to become active and get the benefits. So 150 minutes of aerobic physical activity a week is recommended to achieve health benefits. And that's moderate to vigorous intensity, enough to make you puff, but not enough to make you not be able to carry on a conversation while you do it. And bouts of 10 minutes or more, you don't have to do it all at once. And you certainly also shouldn't go for a walk for 30 minutes and then decide you can sit down for the rest of the day. You should include strength and balance exercises or activities at least twice a day, in addition to those 150 minutes. And they're especially important for those with poor mobility. There are a couple of questionnaires that you can complete to make sure that you're okay to join in an exercise session, or that you should see a doctor first. And these are available through your public health team. We have also created a guide to make sure you choose which is the best exercise class for you when times are normal, and that form is called "Which Exercise Class is Best for Me?" Take advantage of whatever you can do to move. If you're watching television, stand up out of your chair during the commercial break and take some good deep breaths. And this is an excellent way of improving the strength in your hips, backs, legs, and filling your lungs. It'll help your digestion and your breathing and get you ready for the next period to cheer on your favorite team. One of the most important things you can do too is to have your medications checked. And your pharmacist is a very good person to talk to about your medications. Because as we age, the way some medications work or are handled by the body can change and increase your risk of falling. Medications that can help you relax, help you sleep, or improve your mood can also increase your risk. The more medications you take, the greater your risk of falling. It's a very good idea to have a current list of medications with you, and you can also get a printout from your pharmacist. You should never take someone else's medication. Medications are prescribed specifically for that person, depending on their age, their symptoms, etc. It's really important only to use one pharmacy and not to go from one to the other, so that the pharmacist in your chosen shop is aware of all the medications that you take. As we age, our bodies do not break down alcohol as efficiently as it did, so it's best to minimize the use of alcohol, as even a small amount can increase the risk of falling. The combination of having a nightcap and a medication like a sleeping pill is particularly risky. If you're unsure about whether it's safe to drink alcohol or take cannabis with your medication, speak to your doctor or your pharmacist. Another thing that's really important to do is to have your vision and hearing checked every year. As we age, our vision changes, that we know. We become more sensitive to glare. We need more light to see at night. People who are 60 need 10 times more light to see at night than teenagers do. It takes our eyes longer to adjust to sudden light changes. It becomes harder to judge distance and depth. And that's why it's so important to have our vision checked yearly. If you wear bifocals or multifocals, you need to be especially careful. Where the prescription changes on your lens, you don't always get clear vision, so you have to be really careful when you're on stairs and curbs. You need to tip your head down and look out over the top to see better. So if you can, avoid wearing bifocals while you're on the stairs. Remember to clean your glasses frequently. And a night light is especially important if you do get up during the night, and it's very cheap to run. The cost to run a night light, a 7-watt night light in an 8-hour night, is 10 cents. Hearing. Funnily enough, it's really important to check your hearing, and hearing is related to falls. And also, if you do have hearing aids, to wear them. Researchers have found that people with hearing loss can be 3 times more at risk of falling. And one of the reasons might be that people with hearing loss have less environmental awareness. They don't notice things happening near them, such as other people, pets, or other things coming up behind them. Dr. Frank Lin from the Johns Hopkins Institute has said that many researchers also suggest that people with hearing loss need to use more of their mental resources to hear and interpret speech and other sounds, so they have less mental energy left for other tasks such as balancing. Gait and balance are things most people take for granted, but actually they're very cognitively demanding. So if hearing loss imposes a cognitive load and you're concentrating on listening, there may be fewer cognitive resources to help with maintaining balance and gait. Another thing that you can do, which is really important and easy to do, is to check the hazards that are right under your feet at home. As we accumulate things in life, we get used to having them around, but they can also clutter up the space we use to move around in. Stepping over or around things, having slippery floors and rugs, loose wires or extension cords can all trip us up. And all of these things are preventable. Good lighting is really important, and making sure that you can see where you're going, especially going to the bathroom at night. And steps and stairs should have rails. So what's wrong with these pictures? These people are just not paying attention. They're multitasking, and the guy on the snow is not wearing the right shoes for the winter conditions. It is really important to focus and pay attention when you're in unfamiliar settings or walking on uneven ground or stairs. When you're walking in the winter, for example, ice and snow and piles of snow can become barriers to getting about. Try and keep your walkways clear of snow, and if you can't do it yourself or they don't have a snow removal program, there are programs such as the Snow Angels to help. Use ice melt or sand or even kitty litter on your walks for traction. Try and avoid walking over drifts or snowbanks and go around them, and use boot grippers on your winter boots to give you better traction on ice, and you can get ice pick type of tips for your walking cane. So what's wrong with this picture? There are 14 errors in this picture, and I'll go through a few. I'm sure many of you will find more than I'm going to put out. So first of all, the stairs have no handrail. There are extension cords everywhere, and there are loose ones right in the traffic areas. There are loose rugs that have also turned over. There's clutter on the stairs. There's no handle on the door. The telephone is out of reach. The glasses and the book or newspaper are all out of reach. The smoke detector is deactivated. There's a cloth on the space heater. The outlets are just a trifle overloaded. There's cigarettes left unattended. There's no automatic shut-off on the coffee maker. There are open bottles of medicine, and the medicine cabinet is open and unlocked. Now, not all of those are related to falls, but the first few that I mentioned are definitely related to falls. And it's really important to look at those and think to yourself, well, do I have a rug like that? And do I wear slippers like that? Maybe it's something that can be done to prevent falls. There is an excellent document called the You Can Prevent Falls, and it's available through your public health agency, but it's also on our website, www.stopfalls.ca. And it's a very good checklist, and you can use it to walk around your home and see where you can take precautions and some proactive changes, and your family may be very, very happy to help you with this. And this is a great way to track your progress in taking charge of your health and minimizing your falls risk. We've talked about the ones I have checked off, and we'll be covering the rest in our next session. And this form is also available on www.stopfalls and from your public health agency. So we've talked about completing the Staying Independent checklist every year. We talked about having a regular medical checkup every year, or however frequently your doctor suggests that you do it. We talked about having a vision and hearing checkup every year, a medication review every year, taking regular physical activity of 150 minutes a week, strength and balance 2 times a week, and then completing a home safety check. So the next session, we're going to learn more about being the best that you can be. And the areas that we'll cover next time, we'll look again at the medical review. We'll look about nutrition, more about physical activity, use of walking aids and appropriate footwear. But the main message is that you can take the first steps in managing your risk. You can complete the Staying Independent checklist to see if you're at risk of falling and how you can stay safe. You can always let your healthcare provider know if you've had a fall. You can review the You Can Prevent Falls pamphlet, and you can start making a falls action plan so you can continue a healthy, active life. All of the documents I've talked about are available on the Stop Falls website, and there are other resources there that we'll talk about next time. So, to conclude, falls are not a normal part of aging, and many falls are preventable. Reporting a fall, a near fall, or a stumble is really important. You should tell somebody. You can take action, and you can be in charge of your own destiny. Identify your risk factors and make a plan. Anyone can fall, but as we age, the risk increases, as does the risk of injury. The good news is that falls are not a normal part of aging, and you can take charge. Thank you.